Well, hey, everybody. I am here with another Dr. Heidi interview, and I'm so thankful that we're able to do this again. And I have to say, what's really good about this is I was able to corner you really quickly, but what's bad about it is because you're recovering from an injury.
Yeah,
And how are you feeling? You recovering well, buddy?
I'm feeling great. I'm feeling really good. I just can't wait to be able to walk on 2 feet again.
There you go. Yeah,
Never
yeah.
take that for granted again.
We were just joking about this before I hit record that some people think you had a skiing accident or a sledding accident. It was a snowboarding incident, right?
Snowboarding attempt. Yes. Yes. I'm
And are
not
you
gonna
ever
set
going to
that.
do that again? Are you going to get
Ever.
back on that snowboard?
Ever. My butt's going to be on the ground at all times in the snow from now on.
Well, we have definitely been praying for you, and I know
Thank
you got to be
you.
stir crazy because I've known you a long
A
time.
little
You are
bit.
a go-getter. You like
Yeah.
to be out doing things. So to see that you're still smiling while you're recovering is good.
I'm trying to think of the positives of this injury. So
That one leg you're able to put weight on is going to be very strong.
it is. It is. I'm really toning that leg up. So
Well, I appreciate you taking time to let us talk again about what's
yeah.
going on with this pandemic. And we wanted to focus this specific conversation on the vaccine since that's the big phase we're in right now.
Yeah.
And could you just kind of tell us how are vaccinations going right now in Northern Kentucky from your perspective?
Northern Kentucky, honestly, is going very smoothly. I think we've been very lucky from the beginning to, get many allotments of the vaccine, even to start with in December, and continue to get those on a weekly basis. And then the rollout has been very smooth. St. Elizabeth, along with the Northern Kentucky Health Department, has been doing them from the beginning. Health Point Family Care is participating now, and then many of the retail pharmacies, as you know, over the past couple of weeks have started vaccinating as well. So, I think we've been very fortunate with our vaccine rollout in Northern Kentucky.
Mhm.
Numbers wise, almost 89,000 vaccines have been given in Northern Kentucky.
Wow.
And out of those, about 31,000 have already received their second dose. So those people have already received 2 doses. So
That's
that's
great.
great. So and as soon as appointments are available, they are filling up. So that's a good sign, I think, that people are, getting in there and anxious to get their vaccine series started. So
Yeah, that is so true. I know that I heard months ago, and I don't know how long ago this was, but maybe you heard this too, almost this skepticism about the vaccine. And part of me wondered, wow, once it's available, will people jump on this or not? And to see that,
yeah,
once they say we got more appointments, it books up pretty fast. I think
it
that's
does. They're
telling.
gone in a matter of like hours. I know St. Elizabeth released a lot of appointments one evening last week, and it was a couple hours they were gone.
Mm,
So, and I know the Kroger regional vaccine clinic, they have been filling up, releasing appointments as soon as they can, and they are filling up too. So that makes me happy, hopeful.
yeah, absolutely. And I have to say that a little shout out here, what some of the local pharmacies are doing are finding ways to make sure they use their doses and use it well. And I got
Yeah.
permission to say this, but there's a pharmacy in Owenston, Cole Family Pharmacy, that with their allotted doses, they were looking to be very targeted with that. And they partnered with our daycare at Hickory Grove and made sure
That's
the daycare
awesome.
workers got all vaccinated.
That's great.
uh, so really cool things like that are happening. People are
Yes. And
just
a lot of the smaller pharmacies are beginning to get the vaccine. I know that Nee's Pharmacy and Independence said they were going to get it. I don't know if they've gotten it yet. Just this week they said they were going to be getting it. I'm not sure when, but I think that's awesome. So,
oh, it really is. It's really neat to see how it's happening. It's like almost everybody's coming together. We're going to find people are informing, hey, we found out there's
right.
opportunity here to get vaccinated. People post about it and just
Yes,
spread the word.
exactly.
It's been really
Exactly. That's very
cool.
nice.
Yeah, I'm still thinking we're literally approaching the 1 year anniversary when we're all like,
Yeah.
we need to shut things down. And to see where we are now, I think as much maybe impatience as we felt, in the fall, maybe, or maybe even in last spring, to see where we are now, to me, it's mind blowing.
I think it's amazing how far we've come in a year and how much we know now. And, just thinking about not knowing how it was going to be a year ago. You know, you go into the pandemic and the shutdown, you know, a year ago, and it's like, oh, schools are closed for 2 weeks, and you're like, oh, okay, you know, and then
Yeah.
we're a year later, you know, some schools are just starting to go back in person. It's just crazy. I'm kind of glad we didn't know everything going in.
That's probably true. We wouldn't have been able to handle knowing that. I remember
No,
when we
no.
closed in-person gatherings at Hickory Grove, we kept putting we were always afraid someone would show up thinking they could
Yeah,
just come into the office. So we would hang signs on the doors and we would put a date for the campus reopening, and we kept changing the dates. And
right.
I remember Travis Risher on our staff was kind of like, should we just like leave a date off at this point
Yeah.
and say,
To be
what,
determined.
yeah, TBD. And we ended up,
Yeah.
of course, doing that. But yeah, we've come such a long way. What is there something, there could be people still out there that are like, I just don't know if I'm going to get this vaccine when I can. Is there anything that you would say to someone to put them at ease about it?
Um, Definitely I would try to find out from them like if they have specific concerns about the vaccine, you know, because sometimes just pinpointing that for them and then addressing that concern helps put their mind at ease. I know I've talked to a lot of people in the office about it, and you know, a lot of people, their concern was that it happened so fast. And well, there's reasons that it happened so fast, you know, and once we kind of talk about it, they're like, "Oh, okay, that makes sense," you know. So I would try to see if they have a specific concern. I would encourage them to talk to their healthcare provider about it as well. You know, a lot of people, unfortunately, they get their information from other sources, or their friend got it and their arm hurt, and or you know whatever, and you know, just trying to seek out the information, you know, from your healthcare provider if you have specific concerns, instead of relying on Facebook or some other crazy
Exactly.
article, or you know, a family friend, you know, just to try to help ease their concerns. And then, you know, I think the other big thing that I feel like we need to stress to people is that the vaccine is not just to protect you, it's to protect everybody around you, your loved ones, your family, your neighbors, the stranger you meet at Kroger, you know, as well. So you know, in my mind, I think about loving thy neighbor, and you
Yeah.
know, trying to protect everyone like I want to be protected. And you know, if I want people to do that for me, I need to do that for them too.
Mhm.
You know, and the vaccine is it's for the greater good right now. It's a way out of this pandemic. It's the quickest way out of this pandemic state, you know, to try to get back to a more normal life. So you know, just remembering that as well, you know, even if it's not for you, you're not worried about yourself getting it, or you know,
Mhm.
dealing with it. You know, what about your mom or your sister? I'm sure we all have somebody in our lives that is, you know, maybe higher risk for some reason, that you know, think about them and get it for them.
Oh, that's great. That is a great word right there. So some of the questions about the vaccine that I know I've heard people ask, maybe, and even myself have wondered, that I wanted to throw your way. Can someone who is fully vaccinated still carry the virus and spread it?
Yeah, so that is a great question, and definitely something that we want to know and want to find out, but it's honestly still being looked at. We are
Yeah.
not positive yet if you know, getting the vaccine prevents you from spreading it to the others. So the concern is that potentially, um, you know, you're fully vaccinated. If you would get the virus, or you know, have the virus, you potentially could spread it to others even if you're not sick
That's
at
very true.
all. So they are looking at that, and that's something they're obviously following with, you know, the continued trials. But you know, that's one of the reasons that we have to continue, even if we're fully vaccinated, to mask and distance and follow those same precautions right now.
Mhm.
But you know, I think that's something we will be finding more out about in the, you know, coming months, hopefully.
Yeah.
There
And
haven't really been studies that show that yet, you know what I mean?
okay.
That people are passing it on even if they're fully vaccinated, but it is like a, you know, theoretical potential concern.
Yeah, no doubt. And I guess in my mind, and definitely correct me on this, the more vaccinated people are, if we get such a large percentage of our population vaccinated, even without this knowledge, there's some confidence that can happen that with most of us vaccinated, we're not going to get severeness of the symptoms.
Yes, you're exactly right. You're exactly right. So that kind of, you know, starts talking about like the herd immunity. I know we've all kind of heard about that with the vaccine. So you're exactly right. The more people that get the vaccine, the better off we are as far as, the spread of the virus, but also, like you said, just decreasing the severity of the illness if we do get it with a vaccine. The vaccines have been shown to obviously decrease the spread, but also significantly decrease the severity of the illness, which then in turn decreases hospitalizations and deaths from the virus. So, moving forward long term, that's going to be the goal. Just like the flu, we have the flu, we see it every year. Yes, people still get very sick from it, but with a vaccine, we decrease the severity, decrease the spread. So like that, we want to do the same with COVID, be able to handle that better and bring it under control, so we're not in a pandemic state anymore. And we can do that with a vaccine, because like I said, it has been shown to be very effective in decreasing the severity.
That's great. I think that that's very good to hear, because I think in my mind, there's maybe a part of me, maybe a part of other people I know, that think there's still going to be this switch where we don't even use the word, COVID anymore, and it just goes away. It sounds like we're going to be, this is a reality that we'll learn to live with, but because of the vaccination, we don't have to worry about the death and the severity if we can get everybody vaccinated. Is that
Right.
kind of where we're
Right.
heading with that?
Yes, exactly. We want to make it so that it's not something that we have to worry about overwhelming the hospitals and things like that. And that's what we're, hoping obviously to do with the vaccination, but it does require majority of people getting it. So
Wow, that's a great way to look at it. So this word, so many new words we've learned in the past year. I never have heard or remember ever hearing the word efficacy in my life till this year. And so that's been the word used to, I guess, to show how well a vaccine defends against a specific virus or disease. So tell us about the efficacy of the vaccines right now. Maybe summarize what we know about that.
So I know a lot of people are asking about, is one better than the other? Should I ask for this one or that one? And the short answer is no, we can't really be picky yet. With it coming out, it's kind of like whatever the pharmacy has that at that time is kind of what we get. And I know with the Moderna and the Pfizer vaccine, obviously they're very effective, 95% effective at preventing the virus 2 weeks out from your second dose. So there's a time frame on it. So 2 weeks out from that second dose is when you get that efficacy. But the Johnson & Johnson, which obviously came out just recently, it's about 66% effective, but it is only a single dose, one dose. And if we really look at efficacy of vaccines, I think we've been kind of spoiled with the Moderna and Pfizer being so effective.
Yeah.
People are like, oh, I don't want Johnson & Johnson at 66% effective. But for those people that are maybe, lower risk or, younger, healthy populations, that might be a good vaccine for them. Maybe not those older populations that have a lot of health problems getting that one. But, a lot of vaccines are even less than 60% effective. So really the Johnson & Johnson is, kind of on par with a lot of the vaccines that we have. For example, the flu vaccine, 50-ish% effective every year,
There you go.
just because of the different strains of the virus and how we get variants. But I don't want people to be deterred by the Johnson & Johnson vaccine, because it's a good one too. And I think the benefit obviously is it's only one dose. So you
Right.
don't have to worry about, scheduling that second dose, or are they going to have it? Are they not going to have it? Or, people coming back. So,
Yeah.
I think we're very, very fortunate with the vaccines we have on the market right now.
Oh, absolutely. And I think too, hearing 66% efficacy, but not taking into consideration how effective it is at preventing severe COVID and
Exactly,
death and
exactly. So that's the other
hospitalization.
thing with, the Johnson Johnson is it was the same as the other vaccines. When they did the trials, there were no hospitalizations and no deaths with the people that received the vaccine. So, it's still doing what we want it to do long term,
Mhm.
with preventing severe disease, hospitalizations, deaths. So, and it
That's
sounds
really
really good
good.
until you compare it to the 95%.
I know what you mean though, because
So,
I saw that same thing when I thought, oh man, I ended up my first dose I've had already of Moderna. I'm like, I'm kind of glad I got the 95% one.
yeah,
And then you look at that, I'm like, but still, once you read up about the Johnson Johnson, how it's going to be able to be stored so much more easily,
yes,
it's going to be able to be gotten out to the masses so much more
right.
quickly.
Single
It's
dose and
super
done.
exciting.
That's
Yeah.
a big thing. So,
Yeah, that's awesome.
yeah.
So will we have to, is there any word out there right now that says, hey, get ready, everybody. This is going to be an annual vaccine like the flu. Is that what we're thinking we're going
Yeah,
to be getting
so that's
into?
another thing we don't have all the information on yet. Obviously there's still gathering that information. Part of it depends on how long the vaccine induced immunity lasts. And,
Okay.
we obviously don't know that with it only starting to be rolled out in December. Obviously, they did trials before then and they're still following those people. But, the viral induced immunity after you've had COVID, the low end is about 3 months for immunity. And very likely it lasts longer than that, but we don't want, to kind of give people a free pass for longer and then they're not immune any longer
Right.
um, past that 3 months. So likely the vaccine induced immunity is going to last longer, but we don't know exactly yet. So it will depend on that. If they find that this vaccine induced immunity lasts 12 months, then yeah, probably, annually we'll be getting the COVID vaccine just like we do with the flu vaccine. But it depends on what we find out from those studies still.
Another thing that we're still researching, and I think that's important for us to know, is I think that people still underestimate, a year ago, a little bit over a year ago, brand new virus, brand new disease.
Right.
And it's still, I think we still underestimate that we're learning so much.
Right, right. And we still are. And that's, especially about the vaccine, obviously.
Hmm.
But I think that in the coming months, we'll get more information on that and then better know, is it going to be an annual thing or what?
That's right. So a
So
lot of talk's been happening about variants, and I know that everything I'm reading is like, hey, we're just seeing increasing uh, uh, knowledge of the variant from UK, especially that is becoming more and more a percentage of cases in America. Although it seems like we've plateaued and some good news has been happening. So for those getting the vaccine, should they still be concerned about these variants, even though they're vaccinated?
I mean, it's always a concern, but you expect viruses to mutate and to change. That's kind of what they do, and they expect that to happen with this virus too. Um, but with the information we have right now, studies suggest that the antibodies that we get through the vaccines are recognizing these variants right now, and are not an issue with not covering those. So that's a good thing. But obviously, some of the concern with the variants is just the increased spread, more contagious, more severe illness potentially with some of them. So, you know, uh, that's one big reason that, again, another plug for masking and distancing. We can't
Right.
get too lenient yet because, with that variant increasing right now, we still want to be cautious
Mm,
and take all the measures that we have been taking to help prevent that. And I think it's so important right now. It's like we're kind of getting to the finish line, and we don't
mhm.
want to just like be done with it, give up right before we get to the finish line. We have to like see it all the way through, and we're
Yes.
at that point. But especially these next couple of months as we're rolling out more vaccines and this variant becomes more predominant in the states, it's going to be extra important to stay cautious. So,
Uh,
the hope is that if we continue to do what we're doing and we're rolling more and more vaccines out, then we will hopefully bypass another potential surge with
Yeah.
the variants. So
Yeah, it's so funny that you said that about being close to the finish line. I read a quote from another physician saying, if people suddenly start ripping off masks and gathering with no restrictions right now, as it's so tempting to do, it's like running the marathon and you're 100 yards away from that finish line and you decide to just take a seat on
just,
the
yep,
ground.
I saw that same article.
Did you see that?
Yeah.
I'm like, oh man, that is the worst. Let's not do
Right,
that.
right. You're like, you're so close. Just get there.
Yeah, yeah. That is such a good reminder because I can sense like even in my own self, I'm like, oh, the weather's warmer.
Mhm.
The cases seem to be going down, and
You
great
are,
news
yeah.
we're hearing from the governor of Kentucky, and for the CDC to actually even say in any scenario that you could take a mask off is kind of a big deal. And they,
Right. I saw their guidelines for as of yesterday, like their guidelines for vaccinated people. I'm like, whoa.
yeah, so they get together vaccinated, they can take their masks off.
All
I'm
proof.
like,
Yep.
all right, all
I
right.
know. We're moving in
Uh,
the right direction.
That's exactly right. So that's a good word, good reminder that we need to stay vigilant. Let's not let up at this point. And my hope too is maybe that's even a motivator for those who are still trying to decide if they're going to get the vaccine when it's available to them. Let's do that. Let's step
Right.
up, do everything we
Especially
can.
with the variants too, like you said, as they see that they are, maybe spread a little bit easier and maybe cause more, severe illness and more people, and if those antibodies, with the vaccines we have now recognize those, then, even
Mhm.
more reason to continue to do that.
Oh, that's good. Speaking of that, just generally speaking, how are things in Northern Kentucky? We still seeing good outcomes right now, lowering of cases? Are we plateaued?
Yeah, we've as far as like hospitalizations, we've kind of been plateaued for the past week or two.
Okay.
As of last week, hospitalizations were running about 60 to 65 people
Okay.
in the hospitals, which obviously though is significant decline. We were up to over 200, 210, 215 at one point,
Wow.
in the kind of mid-February, I guess, or middle January, end of January.
Okay.
So obviously we're moving in the right direction. The positivity rate in Northern Kentucky is about 6%.
Okay.
All the Boone, Kent, and Campbell counties are somewhere in that 6% range. But their active cases are continuing to decline in all the counties as well.
Mhm.
So that's, I think, a positive note. With knowing that, and I think, obviously part of that is vaccines. So
Yes. Yeah. Such good results. I mean, it feels so good to hear that, and been hearing that statewide results are rate of positivity declining, declining, and declining. We know here in Northern Kentucky, we've always been in like the top, 3 to 5 areas in the state that are having the most cases. So
yeah,
to hear that good news here is really, really awesome.
yeah, yeah. So that's an improvement, and just kind of I think I was kind of impressed by this statistic. So, obviously, like you said, we're almost a year into this pandemic. Well, this week will be a year for this area anyway. For our area, and cases in the U.S. There's been 29 million cases,
Wow.
524,000 deaths. But over the last 2 weeks, the death rate has decreased as well.
Wow.
And I read that as of, I guess it was probably over the weekend, 31 million people have been vaccinated. So that's more than even the total number of cases.
Wow.
So I think that's very, impressive considering the vaccine's only been out since, middle of December.
Wow, that is impressive. I remember the language being used early in the pandemic is, we have a fight. We're kind of warring against an unseen enemy here. And
Mhm.
to hear that, it almost feels like a scoreboard. And 29 million cases, but now we've vaccinated 31 million. So take that, COVID.
Right, right. We've already beat you,
Yeah,
in the
yeah,
numbers. We're already above that. So I
that
think that's
is
pretty
awesome.
awesome.
So I think I hear this a lot from people. It's probably the most common question I get asked. And so, since I have a medical professional in front of me, your honest answer about this, what will it take for us to finally not wear masks and be able to not social distance anymore?
The first thing is more time and patience. One of the things we're trying to figure more out about too, though, is the vaccine in the real world. Obviously you do the trials and you have this, smaller sample size, but how does the vaccine work in the real world? So, obviously more time to collect information on that, but then kind of getting back to like that herd immunity. So, that enough people are getting the vaccine in the community so that they're protected. Either from the vaccine or they've already had the disease that contributes to herd immunity too. Just so that, if majority of people have it, you decrease the spread, and you're helping protect those people that can't get the vaccine for whatever reason as well. When you get it, there are going to be people, obviously, just like with any other vaccine, that aren't able to get it because of maybe allergies or medical conditions or
Oh, that's true.
medications they're on. So we want to help protect them too. And when you look at herd immunity, the percentage needed to reach that varies by the virus or by the disease. Right now, they think for COVID, herd immunity would be reached when about 60 to 75% of the population have had the vaccine or the disease.
Okay.
So that's pretty typical. And to kind of give you a reference, there are some viruses that it takes much higher percentage to reach herd immunity, and others that are less. Like the flu is only 33 to 44% to get to herd immunity.
Oh,
So,
wow.
we're kind of in the middle with COVID, but that's 60 to 70% is pretty typical. So, I hope that we can get there sooner rather than later. Some projections show that if the vaccine rollouts happen like they're expected to over the coming months, we could be there by maybe midsummer. I think that's a very lofty goal. It would be amazing, but hopefully by at least the end of 2021 we'll be at that herd immunity state. But a lot of it depends on the vaccine rollout, and then obviously people getting the vaccine.
Mhm.
So, but all the manufacturers are, continue to ramp up their production. And I know at least Northern Kentucky is getting more and more, every week their weekly allotment has gone up as well. So, that's gonna help.
That is so good. That's good to know. I think that my big takeaway from what you just said is let's be patient. Let's
We
not.
come this far. Let's not get
Yes.
get too crazy too early now.
Yeah, because I believe, like, I know that we talk about how this has changed our world, and there's going to be some things that maybe aren't the same. And there's probably a lot of truth to that. But when people start saying, and, does this mean that we'll uh, never be able to do anything altogether again? I'm like, that's not true. I mean, you just,
No, I don't think that's true at all.
yeah.
It's just that we need to be more patient with it. And
Mhm.
I've said this before, we're not a patient
We
people
are.
anymore.
We are not.
Everything is instant.
Yeah.
Um, so just being patient, and it's going to take some time to get back to that normalcy. But I think there will be some changes that stick around. I think it would be weird now if we're not wearing masks in the doctor's office or the hospital, to be honest. I mean, I don't know when that's going to go away, or if
Right.
it's going to go away. But as far as like gatherings and schools and masking and all those other places, I think we will get back to more normal. It's just going to take a little bit more time. And I know people are tired of it already and have been tired of it for months. But like you said before, we're like so close to that finish line. We don't want to sit down and give up yet.
That's so true. I had this little bit of a personal epiphany yesterday. It's strange as this sounds. We let our TV set without watching anything for a long time. And when that happens, it does a screensaver of photos that I've backed up on the cloud, and it was showing photos from this past year. And the thought that came to my mind was, and I hope this encourages people. Like I look back on the year, and it was obviously we would not ever want to be in a pandemic year again if we can ever do anything to prevent it. But I also saw myself, safely being with family with masks on, distancing us in a driveway together, distanced eating, and just remembering the things we did safely to still be
Sure.
human beings, if you will. And
Right.
I thought, you know what? Golly, it could have been, as strange as this sounds, there could have been a lot worse too, you
Yeah,
know?
it could always be worse. You're right, for
Mhm.
sure. But yeah, we just found new ways of doing things and, like you said, and enjoyed that time. And I had the same thing in a lot of different pictures, like with the kids and just being outside and
Mhm.
making lots of desserts and cookies,
Yeah.
different things like that. But just, having time to do some of that you don't maybe normally have.
It's so true. Those are the things that I hope we'll also be able to look back on. And I
Yeah.
want that to motivate me to stay focused on continuing to mask and distance and say, hey, we're still in that zone. We're still in that mode right now. We're still got a fight ahead of us. Let's finish the race well. Let's
Yeah.
run hard to the
Yeah,
finish line
exactly.
together. And, I'm definitely going to join with you in helping people understand we still got to do that.
Yeah.
And this is awesome. Hey, one more question I have for you.
Yeah.
And I think that I also look back on the year that was, and I remember, in late March, April, just how well humanity did at really caring for the people on the front lines.
Oh,
And
yeah.
I have to say that it's bothered me a little bit to see how that's changed a little bit. I've heard teachers say people really, really were, encouraging us last March and April, and now they're just upset because of everything going on,
Right.
and some of that's gone away. I know that early in the pandemic, just seeing how people really cared about our healthcare
Yeah.
professionals on the front lines. Back then, was there enough PPE for the healthcare
Right.
professionals? So we were all in that together, and I know that now we're all just kind of like, let's just get this thing over with. So it causes me to wonder, how are you and your colleagues doing right now? What is the feeling? Is there anything specific we can be praying for you all about? And what's the mood, if you will, of our healthcare professionals right now?
I think, at this point, it's more hopeful. I think obviously people are tired and you get kind of, I've said this before, like mentally exhausted just hearing about COVID, talking about COVID,
Oh, I bet.
discussing COVID all day and trying to, I don't want to say trying to convince people, but trying to make people understand better, what it is and what we are dealing with still and why it's important to do those precaution measures and get the vaccine. But I would say, at this point, everybody's more hopeful. I feel like we can kind of start to see that light at the end of this very long tunnel. And there are still, I mean, so many people in the community that are so good to, all of the healthcare workers, especially the hospitals, the ERs, the different floors, through all this that have continued to bring meals and make
Mhm.
hats and different masks and
Oh,
all
that's
that kind of
great.
stuff. So yeah, they're continuing to really really watch out for us.
That is great to hear. Yeah, because it's still needed. I mean,
Definitely.
and I think people forget too that you almost, I hate to say it, but it's easy to dehumanize
Mhm.
healthcare professionals, first responders. You all are not robots. You have family too,
Right.
and
We're human like everybody else.
you're fighting COVID for the world, but you're also like, I want to see my kids get to play sports and be
Right.
in school and all that too. And I'm glad that it sounds like people are still remembering that and
Yes,
encouraging you all.
definitely. Definitely. So
I'm glad to hear that the healthcare professionals are feeling that same hope and a
yeah.
light at the end of the
Yeah.
tunnel. That's great to hear. Great to
Pray
hear.
for our continued patience.
Yes, I think that's for every single one of us. Like, okay, help us to be patient, and
Yeah.
God give us that ability to do that and stay the course. And I believe if we do that, we're going to be able to do a lot of the things that we've been wanting to do, but maybe even quicker if we do some of the
Exactly.
things my big takeaway from you today is like, hey, if we continue to do what we're doing, and if more and more people will accept getting that vaccine as they continue to roll out, this could be the year we say we beat it.
Right.
And
Exactly.
I think that's
Exactly.
very inspiring for sure. So,
Yep. That's my hope.
well, thanks for taking some time to let me record you again via Zoom.
You're
And
welcome.
people love getting to watch this, and they have always told me this is super helpful to get to
Oh,
do
I'm
that.
glad. I'm
Yes.
glad.
And, we need to do it again. We'll do it again sometime as long as your schedule allows. And,
Yep, we sure will. I'm not
hey,
very busy these days.
yeah, we're going to pray for your recovery that you get to.
Amazing how free you are when you don't have to go to work every day.
Well, it won't be lasting. Well, I hope it goes by fast for you because I know you
It
love people.
has for sure. So, but I'll be anxious to kind of get back in my routine. I'm a person that likes a routine, so it's been hard.
I bet. I can only imagine. We'll pray for Danny, your husband, too. That.
Definitely pray for Danny. He has really stepped up over these past few weeks, kind of taken charge of everything. So the kids too, they've been so good with me and getting me things and serving me my food. And Corbin makes sure he takes me to bed every night and makes sure I'm okay in
Oh,
bed. And
that's
he's so
awesome.
sweet. So they've really, stepped up as well.
That's so great.
Yeah.
Well, we
Yeah.
do love you and your family, and we just thank you so
Oh,
much
thank
for
you.
all that you do, not just for your patients, but for our church and really for Northern Kentucky as people watch this, just to continue to inspire and help people to keep doing what we're doing. So
I
thanks
hope
for
it's
doing that for us. We
Yep, no
appreciate you.
problem. No problem. I appreciate it.
All right, buddy. Well, until next time, guys, thanks for watching this interview, and keep masking, distancing, doing the things, get the vaccine, and let's beat COVID. And let's, something we say all the time, let's keep working as if everything depends on us, but let's keep praying, as I believe a lot of our prayers have been answered more than we even realize. God's impact on this has been huge. So let's keep doing that, guys. And we'll see y'all. Take care.
Bye, guys. Thanks.